Hello, everyone. Thank you to the FUS Foundation for the opportunity to present my work on the optimization of focus ultrasound-enabled liquid biopsy, or FUS liquid biopsy, for brain tumor diagnosis. The conventional approach to diagnose brain tumors involves an invasive needle used to extract a tissue sample for analysis of the DNA, RNA, and proteins. However, surgical tissue biopsy is limited due to its invasive nature, which limits repeated sampling, biopsies at certain locations, and a complete characterization of the tumor. So one alternative to surgical tissue biopsy is a blood-based liquid biopsy, which requires only a blood sample to diagnose the tumor. As a result, the technique is minimally invasive and less painful, easily obtained, and can provide a comprehensive molecular profile. Blood-based liquid biopsies have been performed to determine the genetic profiles of various cancer types outside the brain, such as lung, breast, and pancreatic cancers, because their tumors naturally shed their DNA and RNA into the bloodstream. Glioblastoma, or GBM, is the most common primary brain tumor, with less than 5% of patients surviving 5 years after diagnosis. Limited progress has been made for GBM because the blood-brain barrier, or the BBB, hinders the efficient release of brain tumor biomarkers into the blood circulation. So the goal for FUS liquid biopsy is to replace the surgical needle with a non-invasive FUS transducer. FUS with microbubbles is known to be a safe, non-invasive, spatially targeted technique to reversibly disrupt the BBB for brain drug delivery. In past studies, we've demonstrated that FUS-induced BBB disruption opens a two-way trafficking between the brain and blood, thus enhancing this release of brain tumor biomarkers into the bloodstream. And after FUS sonication, a simple blood draw can now provide information on the molecular profile of the brain tumor to enable precision medicine and improve survival outcome. So the objective for this study was to determine the optimal parameters for safe biomarker release in a mouse GBM model. Specifically, we investigated the impact of blood collection time, FUS pressure, and microbubble dose on both the extent of biomarker release and tissue damage. GBM cells were transfected with enhanced green fluorescent protein, or EGFP, and implanted in the mouse brains. We used MRI-guided FUS sonication to target the tumor center, and this was our experimental setup and the FUS parameters that were derived from our past preclinical studies. The mice were randomly assigned to different groups. The optimal blood collection time was determined by comparing biomarker release at 10, 30, and 60 minutes post-FUS. The optimal FUS pressure was selected from 0.5, 1, or 1.5 megapascal, and the three groups for optimizing microbubble dose were either 8, 40, or 80 times 10 to the 8 bubbles per milliliter, which represents 1, 5, or 10 times the clinical dose. So we acquired contrast-enhanced T1-weighted MRI scans to validate FUS-induced BBB disruption, and the mRNA was analyzed because it has been used as a diagnostic and a prognostic marker in the clinic to monitor therapy response and identify genetic mutations. We observed a significant increase in blood concentration of mRNA when the blood sample was collected 10 minutes post-FUS. When we compared the groups with different FUS pressures, we observed significantly greater mRNA levels in the blood for pressures above 1 megapascal. And when we compared the groups with different microbubble doses, we observed significantly greater blood mRNA levels for higher doses. In terms of the safety for these different parameters, there was an increasing trend between the extent of hemorrhage and both the FUS pressure and microbubble dose. In conclusion, the detection of circulating tumor mRNA is improved with optimization of blood collection time, FUS pressure, and microbubble dose. Specifically, the blood sample should be collected 10 minutes post-FUS for sensitive detection, and the FUS pressure of 1 megapascal and a microbubble dose of 5 times the clinical dose significantly enhanced biomarker release while minimizing tissue damage. I'd like to thank everyone in the Chen Lab for the help and support, as well as the funding agencies that have made this work possible. Thank you.